Hi everyone, welcome back. I'm Ryzen here. Today I want to go over a topic that you guys may be interested about. Maybe you have something at home. So if you have a dog, cat, over time we love our little beasties, but they do get older, and then sometimes when they get older they develop heart disease. Or maybe we do have a new puppy or a kitten that can also have a heart disease. So this video is designed basically to create a starting guideline, so things to understand a little bit about more how the heart works, the mechanisms involved, and a couple things you could do about or things to keep an eye out for. So first I'll start by saying, and it's just a little disclaimer, that if you do have a heart condition with an animal, this video isn't a definitive diagnosis or anything like that. You want to go to the veterinarian and you want to get their perspective and them to take a listen. A veterinarian can't do their job unless they get the hands on the actual animal and then using something like a stethoscope to listen and get a better picture of what's going on. But if you're curious and for more information, let's go check it out. All right, so we'll start off by going through the bases of the heart and then go from there. All right. Alright, so we're going to start off with the basic anatomy of the heart. So I apologize, I'm not an artist by any stretch, nor is this anatomically correct. So if that's our heart, we have 4 chambers to the heart. Alright, so we have our top 2 chambers and we have our bottom 2 chambers. These top 2 chambers, we'll call them left and right, and then these are atrium. And then these bottom 2 chambers are called ventricles. Okay, and then this separation down the middle is called the septum. All right, so when blood flows into the heart, it comes into these top chambers into the atrium. And then from there, they flow between the top 2 chambers to the bottom 2 chambers. And then from the bottom 2 chambers, they exit the heart. We'll go through the actual steps of where they go in a moment, but essentially in order to come into the heart, pass through any chamber, and to leave the heart, there's valves at each one of those. So essentially there's circular little ones. They're either semilunar or tricuspid, which means that there's 3 different parts to them. So either 2 leaflets or 3 leaflets. So we'll swap back over real quick to this picture, which this one shows our basic anatomy of our heart again, and then the direction that they flow. So it goes from the left side of the heart, it's swapped here accordingly. So left side is on this one, so imagine like you're facing a person or the front side of an animal. So from the left side of the heart, you're going from that bottom left chamber, and it goes out to the rest of the body down here. And then when it returns back. So these are arteries, these are veins. And then essentially it's leaving from the right side of the heart. So it goes into the right side of the heart on this side, into the atrium, down to that right ventricle, and then from the right ventricle goes out to the lungs up here where it gets the oxygen. So all blood flows through the lungs there, and then that's where they refill up with that oxygen, why we have to breathe so often, and then it returns to that left side of the heart. So again, so that bottom left chamber goes to the body, delivers all the oxygen, nutrients there, and then comes back to that right atrium. Right atrium, that top right chamber, to the bottom right chamber, over to the lungs, reoxygenate, and then back to that top left side of the heart. All right, so that becomes important in just a moment as well. So when we're looking at canine and feline heart disease, there's a couple most common diseases. So for canines, our 2 most common diseases are mitral valve insufficiency, also known as myxomatous mitral valve insufficiency, dilated cardiomyopathy or DCM, and then for cats, the 2 most common ones they get are hypertrophic cardiomyopathy and restricted cardiomyopathy, HCM and RCM respectively. So for mitral valve, that's going to be your #1 most common one for canines. So what that means is, again, when we go back to this left side. So when you have heart disease, you hear a heart murmur. And what that murmur is how we were talking about that normally this blood flows from this top left chamber to this bottom left chamber. This valve, the one that stops it here, so it's supposed to be a one-way valve, so the blood's only supposed to go in this direction. This valve, the mitral valve, is supposed to prevent any backflow. What happens, as most often as dogs get older, it's most common in small breed dogs, but large breed dogs can get it as well, is an insufficiency in those leaflets. So how we were talking about with these leaflets over here. And so what happens is there's a small backflow of blood going the opposite way. So the majority goes this way, but then as this contracts and pushes the blood out, some of the blood goes back that way. So that's mitral valve insufficiency. Then what happens is when you have the backflow this way, you have more blood in this chamber because you still have the normal amount coming in plus a little bit from that way. So your number one first sign that you can see diagnostically is usually starts with you hear the heart murmur when you auscult it. So how we were talking about before, using that stethoscope to listen. And then so you listen for that heart murmur. When you have that heart murmur, essentially you have two different ways you could look to see what's going on. If it's been going on for a while and there's some changes to the heart, you could potentially see some going on with the radiograph. So if you take an x-ray of the chest, that when you're looking at the chest, essentially if you look here, so say that this is our front leg here, come up, we have our nice little doggy head here. Again, not an artist by any stretch. So when the heart sits here in the chest, it's gonna look more, it actually looks more like this. So that's more anatomically correct for the heart. Here, we'll move up a little bit over to here. So when we're looking at it, so this is going to be what's called a left lateral x-ray image. This left chamber that we're talking about over here is actually sitting right about here. So usually what happens is you start to see what's sometimes referred to as a backpack sign. So essentially that chamber gets enlarged, so instead of being there, it looks more something like that. And so that's something you can see that's more radiographic evidence. And then some other things can happen, like if you have your trachea going along here, it can be dorsally displaced. You can look at the vasculature, so there's several other different things you can look at it. The other part is that you want to look at the lungs. So when we're talking about the progression of heart disease, how we were talking about that you have more backflow here. This goes into this back chamber. So what happens is, again, you have a backflow, you have a backup of blood here, and then eventually, as if you progress into something more along the line of heart failure or heading in that direction, the blood's gonna back up along this pathway. So again, if we go over back to this drawing, so where does our left atrium sit? That's this one right here. Where does that blood, essentially the one going into that atrium, where does it come from? It backs up. See, from our lungs here, they go into that left atrium. So as heart disease progresses, the blood's going to continue backing up, and then it backs up in the lungs. So you get some fluid overload, and then it spills out. And that's what is most often referred to as heart failure, when essentially you're backed up so much that you have fluid going into your lungs. So that's essentially one of the bad forms. There's a statistic, it's about 70 to 80% of cases never progress to that. But again, you don't know. So that's why going to the veterinarian again to get assessment, or the other way that we were going to be talking about was how we talked about x-rays are one way to look at the heart. The other way is called an echocardiogram. So it's almost like an ultrasound that you use to check for pregnancy in women, but instead they use it to check out for the heart. So in it, they're able to look at all the chambers. They're able to measure what the chamber size is, what the muscle layers are looking like, essentially take a look at all the valves, so they can actually sit down and find the source of the murmur. And then based on that, they're able to look at saying, okay, do we have an injection murmur? Can we measure the velocity of that murmur? And then they look at all those different parameters, and then they look and assess the hearts accordingly. And if they meet the correct criteria, then we can go on heart medications. So that's going to be the most often the easy one, because again, x-rays are one component of it. It's great for looking at the lungs, but you can't sit there and assess the individualized different chambers. And so it's very difficult to tell if the heart's actually big enough where you could actually benefit from heart medications. So we'll go over and we'll talk about heart medications real quick. So these are our basic heart medications. Pimobendan is going to be the most common one. What that is essentially it slows the progression of heart disease. Unless the heart is at a big enough dilation and meet all those parameters, that drug won't do anything unless you meet those minimum requirements, which is why, again, a cardiology consult is invaluable, because that's the way to truly tell if you're at that point or not. Unless it's been going on so long and the heart is just so ginormous on the x-rays that if you have a ridiculously high vertebral heart score, then you might be able to go on Pimobendan that way. All right, these other drugs are different components depending, again, on each one of those. Furosemide is going to be one of the most other common ones, where essentially it works as a diuretic. So if you have how we're talking about if the fluid's backing up on the lungs where you're in the point of heart failure, that's where that's going to be key, because that's going to be pulling the fluid off the lungs. So that's another major component. This next one on the list, ACE inhibitors. So the two most common ones are enalapril and benazepril. Enalapril is usually more often for dogs, benazepril more often for cats. And what those are blood pressure medications. How we're talking about that we're worried about the backflow, backup of blood, all that kind of stuff, that you can imagine that as it's sitting in a vessel, having more blood in it, you're going to have more pressure within there. And so what those are more often referred to as blood pressure medications. So that's a way to help to essentially vasodilate, so that way it can essentially decrease the pressure in the blood. Spirolactone is another component that helps prolong the lasting effects of Pimobendan. It's not as common one out there as you see. It was only started to be researched a few years ago, and it's still one of the more useful ones out there, but I would say about 90+% of the cases don't end up going on to spirolactone. It's also a more expensive drug. This last one is another component where digoxin is a very useful drug because it helps increase the contractility of the heart muscles, which is good if you actually have decreased contractility, because then that's one of the few drugs that can actually help contract better. So it's a decent medication, but how we're talking about the majority of our heart disease is this mitral valve, that most cases never have decreased contractility. So that's where that one's not as often of a drug. So that covers our major one for our mitral valve, one of the most common ones. We'll hit these other ones real quick. So dilated cardiomyopathy. So mitral valve is the weakness of that one valve. Dilated cardiomyopathy, DCM, what happens is these chambers get excessively large. And so that's where that word dilated came from. And the ones for cats that most often get is hypertrophic cardiomyopathy. That one, what happens is that cats continue to put down more muscle layer there, and it's also decreases the chamber size. So that's what cardiologists mainly care about, is what is that chamber size, and then it's a combination of the two. It's a very common old age disease of cats, but it is, again, to some degree serious, but a lot of cats can go subclinical, so you never know that they actually have it unless a veterinarian happens to catch it on a regular physical exam, or if the cat's not doing well, comes in to get checked out, and then the veterinarian finds it at that time. Restrictive cardiomyopathy, what that one most often refers to, again, in cats, is essentially there's little strands of muscle and tendons that go and help contract the heart, and they cross these chambers, and so they help contract this way to help with that contractility, like I said. And so if you have too many of them, then you can get what's called restrictive cardiomyopathy. There's most likely a couple other ways you can get it as well, but that's the most common one. So the majority of heart disease you see in dogs are going to be mitral valve, second most common one is DCM, cats. The majority of the ones are going to be these HCM ones. So, there are some other ones though, and these are all typically you more see in older animals. If you have a young animal with heart disease, it's more likely to be what's called a congenital defect or a birth defect. And so for those, there's a range of different essentially diseases. So if you're a young animal, what can happen is you can have extraneous vessels, you could have holes in the heart. So essentially two of the most common ones are called ASDs and then VSDs. So an ASD is an atrial septal defect. So again, how we're talking about that this is named the septum. So an ASD is essentially a passage between these two top chambers. A VSD is a passage between these two bottom chambers. Again, ventricular septal defect. And that's one common one. Another one is, I already have this picture drawn here. So it's called a patent ductus. Apologize on that. Ductus Arteriosus, or more commonly known as PDA, which the Ductus Arteriosus is a natural extra vessel that connects between the aorta and the pulmonary artery. So the aorta is what leads the left side of the heart, pulmonary artery is what leads the right side of the heart. So this side goes to the lungs, this side goes to the rest of the body out there. So those are coming out of the ventricles. And what happens is that there's an extra vessel to help pass through for circulation with the fetus. And so what happens after birth or close to birth is essentially this vessel withers away. So it's supposed to go away, close off, and then you have those two separate vessels. If it stays open, aka patent, you can get what's called a PDA, which can possibly be surgically corrected, where they have different ways of, the newer ones have clamps, where essentially if you have a clamp around the vessel and then it slowly constricts over time, because you don't want to just, ideally you would prefer not to just immediately tie off, because then you're messing with the entire circulatory system all at once. They're right around the heart, and you could potentially die from something like that. So that's why it'll slowly constrict over time. So, but again, you have numerous different causes of a heart murmur. So some of the other common ones would be called stenosis, which is a narrowing. So pulmonic stenosis, aortic stenosis. So again, these vessels coming out of the ventricles, so they're coming out of the bottom chambers of the heart. What a stenosis is it's a narrowing. So if you take a look how we were talking about, if that's your normal vessel coming out, a stenosis would be saying, hey, we have this extra around it, so that way it's only that small. And what happens is, if you think about it like a hose, when you take your thumb and you put it over the top of the hose, that you get a faster spurt out because you're reducing that diameter size, which is increasing the pressure. So you have this trying to get that same amount of fluid through a smaller space. So what happens is the pressure then increases the velocity. And so then you can get a murmur that way. So again, there's numerous different causes at pretty much any one of these junctions that could be causing a heart murmur, aka heart disease. So that's why step one is to go to your regular veterinarian, get a good physical exam, start the workup, and then we can talk about the highest suspicions. Otherwise, then you're working through your rule out list afterwards. And always, always, always part of the full recommendation is to then go get assessed by a cardiologist. Ideally getting an echocardiogram as well, so that way you can look at all those different chambers of the heart. So, but that's the basics for our heart disease. If you have any questions, definitely leave it in the comments below. Otherwise, until next time, congrats on making it to the future. We'll see you then. Some of my beasties. Hi, Rexy. Hi, Mew Mew. Meow. I know.